I enjoy teaching at Campbell because I find the students to be very curious. I also appreciate that Campbell's curriculum includes topics related to lymphedema and oncology and allows the time for students to consider their role in treatment. Lymphedema is a swelling condition that can develop for a few different reasons. I see it in cancer survivors when they've undergone surgeries that include lymph node removal that damages the lymphatic system, and then we see swelling in an area adjacent to where the lymph node removal occurred. Swelling can also occur because of changes related to chemotherapy. We also see lymphedema in individuals that struggle with vascular disease, and the interventions are compression, exercise, elevation, good skin care, and self-care. And the combination of those interventions are what minimize the severity of the symptoms and prevent progression. It's important for physical therapy students to learn about lymphedema so that they can develop the skills in differential diagnosis, recognizing that all edema is not lymphedema. And then they can be a helpful provider within a multidisciplinary team to ensure that patients are getting the care that they need for the symptoms they're having. It's also important for students to learn about lymphedema management so that they can confidently and safely prescribe exercise, because we know that it improves outcomes over the long term. Physical therapists can best advocate for their lymphedema patients by ensuring good communication with other providers in making sure that the lymphedema is what we think it is, and getting prescriptions for compression garments that are prescription grade and well-fitting, so that these individuals can actually obtain the materials they need to manage this over the lifetime that they'll be living with it. So I would encourage someone to seek out a specialization in oncology physical therapy, because when you have the opportunity to treat these individuals, you want to end that patient encounter feeling like you were the best PT they possibly could have seen on that day and in that moment. Our oncology specialization really allows PTs to develop the skills to provide effective treatments, but also the psychosocial skills to meet the needs of the patients where they're at that time, and also their caregivers, in taking a whole person approach to what we can do for them from a rehabilitation perspective. I decided to specialize in oncology after some personal experiences with family and friends who had gone through cancer treatments, and I recognized that the role that PT could play in alleviating the severity of their suffering throughout those treatments. Once I had the opportunity to really be working with cancer survivors, I also felt like I really enjoyed the conversations I had with these individuals, and felt like they learned to trust me with their care. And so even though these can be very difficult situations, I think that I bring a skill to the table that helps them problem solve and really feel better despite what they're going through. What I wish everyone knew about lymphedema is that exercise is recommended for lymphedema management and prevention of worsening of lymphedema symptoms. So we know that maintaining muscle mass helps support lymphatic vessels, and even though there are symptoms that someone can experience that make exercise feel maybe not very accessible, working with a physical therapist can really unlock potential to improve muscle mass and therefore improve lymphedema symptoms. A misunderstanding related to lymphedema sometimes comes down to the treatment options. Lymphatic drainage is a wonderful treatment for lymphedema. It's also very calming. It's a version of massage, but it does need to be an adjunct to other things to help improve symptom management. So words of advice that I have for current PT students is to make sure that you focus on learning how to study so that you can retain the information over the long term. Planning to have a long career, and the basics that you learn in PT school really do carry you a long way. I would also include learning how to ask for help, and not just as a student, but as a clinician, having the ability to identify when you need assistance or guidance or mentorship is really going to allow your career to grow.